Okay, hi everyone. This is good evening and good afternoon, and welcome to this pre-application town hall meeting. We are so excited to have you here with us. And I just wanted to do some quick introductions and let you know a little bit about what we're going to cover tonight. And we're going to leave a lot of room for you guys to submit questions for us. My name is Karen White, and I'm the UCSF Project Director of the Virtual Training Academy, the COVID Virtual Training Academy, which is a joint initiative between the California Department of Public Health, UCLA, UCSF, to train case investigators and contact tracers for the state of California. And tonight, or this afternoon, on behalf of UCSF, UCLA, and our funder, the Skoll Foundation, we'd like to welcome you to this town hall, where we're going to talk about engaging local community-based organizations in developing a cultural humility training tools for contact investigators, case investigators and contact tracers for COVID-19 response. What we're going to do first is we're going to turn it over to have 3 quick presentations, and then we're going to open it up to the panel. And what I'll do first is introduce all of our panelists. I may have them, well, I'll wait and have them come on. So the first panelist we have is Dr. Mike Reed. He's an infectious disease doctor. In addition to his clinical work at San Francisco General Hospital, he works at the Institute for Global Health Diplomacy and Delivery on policy analysis in TB and HIV. Since March, Dr. Reed has been the Chief Medical Officer for the UCSF Pandemic Initiative for Equity and Inclusion, and he's been really the clinical lead for all of our COVID work, both with the San Francisco Department of Health and with the California Department of Public Health virtual training. He is going to give us a quick overview of COVID case investigation and contact tracing. After him, we will hear from Tim Vincent, who's a capacity building program manager at UCSF's California Prevention Training Center. He's worked in the field of HIV for over 25 years in service provision and education. In his day job, he's developed curriculum for HIV providers on a variety of topics to promote health equity. And since COVID, Tim has really been leading the development of our materials around cultural humility, our current training, and then also helping case investigators and contact tracers respond to challenging situations. And he'll be giving a little bit of a presentation on our cultural humility work to date. I will then turn it over to Kelly Taylor, who's a research scientist at UCSF with the Institute for Global Health Sciences. Dr. Taylor is a behavioral scientist with a background in community psychology, epidemiology, and evaluation methodology. And since COVID hit, Dr. Taylor has served as a facilitator in the Virtual Training Academy, as a contact tracer herself, and is leading the community of practice for case investigators and contact tracers in Imperial County. And she will give a bit of a presentation on the Cultural Humility Training Program, the future vision for that, and introduce the funding opportunity announcement. So after that, we're going to go over the Q&As. We'll start with the ones who have been that have been pre-submitted, and then we'll get into some live Q&A from you all. So with that, I'm going to turn it over to Dr. Mike Reed for his first presentation.
Good afternoon, everybody, and thank you for joining today. I'm deeply appreciative of your willingness to attend this session, and I hope that you find it informative, and this can lead to a meaningful collaboration between our institutions and yours. What I'd like to do is give you a brief overview of what contact tracing involves and the importance of this project to build capacity around cultural humility to the broader contact tracing effort. Next slide. I think most of you know this, that one of the things that this awful pandemic has highlighted is the profound health inequities that are at play within our society. COVID has shone a light on the institutional violence, the structural racism that exists within our society, such that certain ethnic and racial minorities are profoundly impacted and have had the most adverse sequelae from this awful disease. And I just wanted to highlight here this statistic published in the New York Times recently that illustrates that Latino or Latinx communities and Black residents in the US have 3 times the likelihood of becoming infected compared to their white neighbors. Moreover, folks from those communities are disproportionately likely to die from COVID and have less opportunities to access appropriate care and resources. Next slide. This is certainly true in California, and the data plays this out. And just to highlight here the racial demographics of COVID-19 infection and deaths, you can clearly see that the Latino or Latinx community, despite being a smaller proportion of the overall population, has been disproportionately impacted, both in terms of number of infections as well as deaths from the disease. Similarly, that inequity is highlighted amongst African American, Black communities, Native American, Pacific Islander communities. So in this context, we know that contact tracing, when done well, when done in a culturally responsive way, can serve an important role in preventing the spread of COVID-19. Next slide. And for those of you that are unfamiliar with what case investigation and contact tracing involves, let me just briefly explain it for you. So these two activities that are often referred to sort of collectively as contact tracing are standard in our work to control the spread of many infectious diseases, not just COVID-19, but have an incredibly important role to play in the spread of COVID-19, particularly given limited availability of other interventions like treatments or vaccines. And so we rely on universal masking, social distancing, and case investigation contact tracing to prevent the spread of this disease. Case investigation involves identifying those individuals with COVID-19, ensuring that they understand the potential for spread and recommending that they isolate. In addition, it involves determining from those individuals who their contacts have been, who they've been in contact with during the period of time while they may have been infectious, so that we can then do the work of contact tracing, reaching out to the close contacts of individuals with COVID-19 to underscore to them the importance of quarantining, so that if indeed they go on to develop the disease, they're quarantined and unlikely to spread the disease to their close contacts. This work, asking individuals suffering from COVID-19 to isolate and asking close contacts to quarantine, is crucial to break the chains of transmission. But it's not a simple process, and asking the most marginalized, vulnerable members of our community to stay at home, perhaps when they're feeling well, to limit their interaction with the wider society, not go to work, etc., can be profoundly challenging, both economically, socially, etc. And so doing this work well is crucial, and equipping our contact tracers and case investigators to sensitively address the needs of those individuals when they reach out to them is crucial. Next slide. So UCSF and UCLA have partnered with California Department of Public Health over the last 3 months to stand up a contact tracing and case investigation training program. And in fact, we've trained over 7,000 individuals over that period of time in the central core competencies of case investigation and contact tracing. And I won't spend any time going through those things in too much detail, except that we spend about 20 hours in online classrooms over a 4-day period, explaining to people what the roles of a case investigator or contact tracer are, and how to do that well in terms of equipping them with the skills to build rapport on the phone, to engage with them in a client-centered, empowerment-based approach to care. Recognizing that every time we pick up the phone is an opportunity for therapeutic engagement. We call these people to listen to them, to understand their needs and anxieties, as well as to help them understand their responsibility in responding to the epidemic. So we've trained 7,000 people, but what does success look like as we think about that workforce? Next slide. I think there's recognition that doing this well, enabling contact tracers to effectively reach people in their community, demands an inclusive response. It demands wherever possible that our contact tracers and case investigators share the same language, have the same cultural experiences, etc. And if you could just advance the animation for me now. And to that end, I think we believe that it demands that every single case investigator or contact tracer has some training in cultural humility, and wherever possible has the same language or is language concordant and from the same communities impacted. Moreover, though, we recognize that this work, engaging people who are full of anxiety, some of whom are sick, who are facing, tremendous economic strains, can be an exhausting process for our contact tracers and case investigators. And so we need to ensure that that workforce is appropriately supported, and is able to access resources so that they can bear the workload that they're facing. I want to just add one thing here. Right now, most of the case investigators and contact tracers that we're working with are people that have been mobilized, that have been sent to us by the local health authority or by the California Department of Public Health. And they don't necessarily hail from those communities that they're serving. We recognize that there is an important need to train community-based organizations to do the work of contact tracing, because they're some of the people that are going to be most effective at doing it. However, we have 7,000 people who've gone through the training thus far. How can we equip them to be maximally effective? How can we give them the tools to be culturally humble as they engage people? Well, with this funding opportunity, we look to partner with you to ensure that what we do moving forward is maximally impactful. I'm going to hand over to my colleague, Tim, who's going to explain to you the content that we covered in the training thus far as it relates to cultural humility. Thanks, Tim.
Thank you, Dr. Reed. So good afternoon, everybody. And again, I'm so grateful to be able to speak with you this afternoon and recognize how many people are interested in our opportunity and to be part of our training that we're doing for contact tracers and case investigators. I had the pleasure of being maybe the lead author, I would say, on our current modules that we're using on cultural humility for the State Virtual Training Academy. As Dr. Reed was just showing on a previous slide, that people are engaging in live webinars on a variety of topics, and then they're following those live webinars with skills labs to apply some of the content and the skills that are described in those live webinars to the case investigation or contact tracing interview. So it was extremely important for us to really give time and attention to the cultural humility approach, and to think about things like implicit bias and assumptions that people make, and how that can impact the ability of a contact tracer or case investigator to really be successful in getting the information that they need to get, and really building rapport and respect and curiosity with the particular people that they're engaging with. And so we do, I would say, a 45-minute module called Respecting the Context that really considers things like mistrust and stigma and socioeconomic status, along with cultural identities and multicultural identities that might also impact how people can respond to COVID-19 right now. And just to say, we're using cultural humility in for this particular training is really described as a lifelong process where an individual examines their own beliefs, their own cultural identities and biases and values, as well as the beliefs and cultures of others, to create an environment of respect and mutual understanding. And so we really do this soon in the training so that when the participants are beginning to practice with the interview scripts, they can really think about how to infuse a cultural humility approach in the work that they're doing. And so we've been doing that throughout our virtual training academy and really feel like more needs to be done. And so I'm really, again, excited that we're expanding this area and looking for ways to partner with people like you to make it even more successful and more impactful. That's really what I wanted to tell you. And again, I'm grateful to work with all of you or any of you who are interested in doing this work with us. And I'm going to now turn it over to my colleague, Kelly Taylor.
Thanks, Tim. Next slide, please. Next slide. So I'm going to talk a little bit about the Cultural Humility Training Program going forward. So why does cultural humility matter? First of all, as Dr. Reed said, contact tracing programs must instill trust. You must have a relationship with the community that you're serving. Contact tracers are delivering healthcare messages to people that they reach out to. And so therefore, they must have the skills and competencies to deliver a message in a way that's client-centered, culturally and linguistically appropriate, and trauma-informed, recognizing that people that you're reaching out to are experiencing trauma, and you want to reach them from a strengths-based perspective, recognizing that all of their psychological, emotional needs during this time. Next slide. So in terms of the goals of this FOA, we're trying to create and deliver a cultural humility training in collaboration with you partners. Developing the training materials, we need to represent the needs and context of perspectives of communities most affected by COVID-19 that Dr. Reed described earlier. Also, we're trying to create supplemental training materials to ensure that all contact tracers and case investigators that are graduates of the Virtual Training Academy have the core skills in cultural humility in order to effectively fulfill their roles. So as Dr. Reed was talking about the more than 7,000 people that have already gone through this training, we want them to have the opportunity to go back through and experience this cultural humility module, as well as folks who would going forward that would be trained in cultural humility. Also, we're trying to implement a supplemental training program so that this practice is transformative and learning across all diverse California settings, and that we're creating a community of practice for our trainers, our investigators, and our contact tracers. Next. So this is a three-phase scope of work, as you've probably seen in the FOA. The first phase will be the CBO stakeholders, those of you on the line who participate in this project, to go through our virtual training course, our virtual training academy as trainees, to learn and experience contact investigation and contact tracing training as we're delivering in our VTA. Then after going through the training, you would serve as VTA facilitators, which means that you would actually be delivering the training to new CIs and new CTs as they're coming through the Virtual Training Academy. So you get the experience of learning what it's like to be on both sides. In phase two, the community-based organization stakeholders would co-design with us a one-day cultural humility training program for California's contact tracers. And then in this final phase, you all would, the CBO stakeholders would facilitate the cultural humility training on your own. Initially, it would start out with us in collaboration with us, delivering the training, and then move to you being able to deliver the training on your own. Next slide. Next slide. So in terms of the application requirements, in terms of eligibility, nonprofits with 501c3 status, other than institutions of higher education with a demonstrated capacity to serve communities most impacted by COVID-19 are eligible to apply. And that last part is particularly important. We want the CBOs who are delivering these trainings to absolutely have the capacity to serve the communities most impacted and have relationships with those communities. In terms of submitting, you must cover the following: a complete agency background, which is in the part 1 of the proposal form. So make sure you don't leave any of those items blank. And if you have questions, we're absolutely here to help. Complete answers to questions 1 through 5 in part 2. Question 3 in particular, we would love for you to make sure you're explicit about your relationships and partnerships, because this is critical to make sure that those on the ground are actually reaching those constituents that are most impacted by COVID. And then 3, all the questions have word limits attached. Please be cautious of those word limits, because we won't read beyond the word limit for that particular question. So if it's 300 words, please be mindful in your word count that you're observing those limits. Next slide. Please read the FOA very carefully. The application due date, without exception, is August 19th, 2020 by 11 p.m. Pacific Standard Time. In terms of award, our notification date, our target date is August the 28th, 2020, and our target start date is September 1st, 2020. So saying that those dates are targets, they are subject to change based on needs of us to evaluate the applications, the number of applications that we receive, and obviously then that would be flexible on the start date if we were to go on beyond August 28th to notify potential awardees. Next slide. There are resources to support you in this process. Today's webinar and PowerPoint presentation and frequently asked questions will be posted on the event page. The link is there, but you can also visit the link, the event page that you signed up to this webinar, as well as there are a list of contacts in the FOA that you can reach out to any of us on that list with the appropriate person based on your question, and we will do our best to answer your questions within the time frame of the application. Next slide. Finally, if you have questions for us today, please type your questions in the Q&A in Zoom. We have colleagues that are curating those questions and we will answer them shortly. Also, continue to stay connected. And you can subscribe to our IGHS, the Institute for Global Health Sciences monthly listserv here at this address. And then finally, we just wanted to leave you with a quote to ponder from, next slide. A quote to ponder from a close contact that was reached out to by our contact tracers in San Francisco that sums up well why the work we're doing right now is so important. Thank you.
Great, thanks to the panel. I'm going to invite the panel now to turn on their videos. And there's one addition to the panel that I didn't yet introduce, and that is Ming Zhao, and she's a grant manager at UCSF Institute for Global Health Sciences, and she's here to answer any sort of administrative or finance questions about this related to the subcontract or RFA, FOA budgeting process. While I'm going to get started with the questions that were submitted earlier on into the website through the survey. And while I do that, if folks want to go ahead and ask any additional questions they have in the Q&A box here. The one thing I'll say is we'll look at all the questions. If the question is very specific to your individual institution, like is this specific institution eligible, for example, we probably won't answer that here in the public forum, but we will definitely get back to you directly and answer that question. So one of the questions we received is, can we partner with other eligible CBOs as subcontractors or consultants? And the answer is yes, absolutely, as long as they are nonprofit community-based organizations, and as long as the partners together still remain within the $75,000 budget cap. The next question I'm actually going to hand over to Kelly Taylor, and that is there a minimum or a maximum number of trainees from the CBO stakeholder that can participate in the VTA course? And another question, do all of those trainees need to be employees, or can they be volunteers or interns?
Thanks, Karen. So we'd like to limit the participants from each organization to 3 to 5. and they absolutely can be interns or volunteers, but those interns and volunteers need to have the skills to participate in the Virtual Training Academy in the background. And they also need to be available for the entire scope of work, the entire duration. So if they have time limited appointments with your organization or will be with your organization for a short period of time, then they should not be the applicants you select to attend the training.
Great. And then another question we have, who will be responsible for the outreach to learners in phase 3? So we're actually going to be delivering this cultural humility module. And it's actually going to be the California Department of Public Health. They identify those, the CDPH identifies state employees who will be redirected to the Virtual Training Academy, as well as the local health jurisdictions who identify contact tracers and case investigators who will be working in their local health jurisdictions. So this training, this follow-on training in cultural humility will be given to folks who have already attended the VTA, and those will be identified by the California Department of Public Health for us. The next question I'm going to hand over to Mike. The question's about the RFA process. Once applications are submitted, is there a scoring rubric that the evaluators will be using to weigh the different criteria needed for this project? For example, what are each of the questions weighed, and are they in particular order of importance?
Sure, thanks. So we're going to score each application out of 100. Questions 1 and 3 will account for 50 points. Question 2 will account for 15 points. Question 4 will account for 35 points, and 5 will not be counted towards your final score. So questions 1 and 3 are really about your CBOs, ability to represent particular communities, etc. And question 4 is about your CBO's expertise or experience doing cultural humility related training or capacity building. And then question 2 relates to your expertise in contact tracing or case investigation. So let me say that again so everybody's clear. Questions 1 and 3 will account for 50 points. Question 2 will count for 15 points. Question 4 will account for 35 points. And question 5 will not be scored.
Great, thanks. We have another question. Will any specialized software product or platform be needed to successfully execute this project? And if so, what is the product or platform? So basically, we'll be doing this all in a remote way. So you all got on this Zoom here tonight, hopefully. So you will be able to need the proper sort of hardware to be able to access Zoom and be able to communicate on Zoom. You'll need facility in PowerPoint and Excel, and really just comfort working in a remote team environment, because even the training will be delivered by Zoom. And, you know, we've become expert in breaking people up into different breakout groups to do, you know, small facilitated groups and practice sessions, et cetera. But sadly, this is what the way of the world right now. So a comfort working remotely, and then just the basic, you know, software, PowerPoint, Excel, et cetera. I'm now going to open it up. I'm going to ask Alice and Stephanie, who have been scanning the Q&A, if they want to ask some of those questions that are coming in to the panel.
Thank you, Karen. Stephanie, were you going to take the first couple, or do you want me? I don't see Stephanie here. Why don't I go ahead and ask the first few that I've seen come in, and some of these are more kind of grant related or administrative related, and one of them is, will administrative costs be allowed in the allocated budget of $75,000?
I can take a pass and then I'll turn it to Ming. So we can allow up to a 15% indirect cost rate inside the 75,000. So it has to be within the 75,000. And then we will also allow for, you know, reasonable administrative costs as direct costs as well. Is that correct, Ming?
Yes.
Great. Okay, another one I will throw out to the team. When you use the word community, do you mean a geographic area? So maybe a little bit more description of how we might define community.
I'll take a shot and then I'll let Kelly jump in. Look, I think we're really hopeful to recruit community-based organizations that are representative of those physical geographic communities, those racial and ethnic communities, those other cultural communities that are disproportionately impacted by COVID-19. So yes, in some circumstance, it will be a geographic region. For example, if you work with a type of profession in a specific geographic region of the state, then you might be eligible. But we're also interested in those groups that are representative of like an ethnic or racial group, regardless of where they are in the state.
Just to add a little bit to what Mike said, we are looking for geographic spread in terms of our communities that we select. So the CBOs need to, the final selection will span the state of California. So regionally, that definition of community does apply to places in the state. But as Mike also said, we want to make sure that we capture the communities that are most impacted by COVID. So the area or the locale that you're serving needs to capture that population.
Thank you. There are quite a few questions here. Here's one that I thought would be helpful to answer if any of you want to take a stab at it. And that is, can a single CBO apply alone, or do you expect a consortium of CBOs per that 75,000?
I can take a stab. I think it's going to depend sort of on the size and capacity of the individual CBO. Like if you have enough, I guess, capacities and folks that are already within your organization that can take on this work, then you could probably do it alone. But if you feel like probably if you're a very small organization, you might want to partner in order to be able to provide sort of the manpower, person power to do the work. Does anyone have anything to add to that?
Okay.
Either individual CBOs or groups of CBOs together.
Great. Thank you, Karen. I believe that this was presented earlier, but perhaps one of you may want to review or just summarize what types of deliverables are expected or required with this program.
So that's a good question. So as I'd said during the presentations, this is a three-phased approach. And in terms of deliverables, your participation as a stakeholder CBO would be required in the beginning to go through the training and then become a facilitator in the training. And then after the facilitation and the training, the second phase of the project that would immediately start after phase one is the curriculum development, which we want CBOs to take ownership of that, but what we would be doing in collaboration with you and supporting you. This is where we lean on your expertise to know what's best for the communities that you serve. And we're anticipating that part to take about a month. And then the rest of the time will be delivering the cultural humility training, which we would initially do in collaboration with you, and then ultimately hand off to the stakeholder CBOs to implement. And that would be the remaining, I think, 4 months of the program. So those are essentially the deliverables. So the final deliverable obviously is, or maybe not obviously, but the final deliverable is an actual cultural humility training module. And the steps reaching up to that include your participation in sort of getting, learning our process in the training academy, and then collaborate with us to help develop that training.
Okay, great, thank you. So I think I'm going to turn it over to Stephanie now, and she's going to take over so you hear another voice. There are lots of questions coming in. So Stephanie, I'll turn it over to you.
Thank you. Yeah, there's a few more that are fiscal in nature. Would a nonprofit organization with a fiscal sponsor be eligible? And similarly, what about an institute that was an ancillary of a university? Would both of those be eligible to apply?
That's a really good question. I might have to go back, Ming, unless you have a thought. I think we basically just defined it as nonprofit community-based organization. I may have to just go back and get some more feedback on whether an organization that's fiscally sponsored by another organization, or that's actually sort of part of the greater, Cal State, UC, or whatever system. Let's take that back, Ming, unless you have any thoughts on that and get.
Yeah, I agree. We need to check with the sponsor on that. Yeah.
Okay, and will there be technical assistance in case there's a question on the application or the template?
Yes, we do provide technical assistance. If you look at the FOA, if you have it handy, if not, you can look at it later. We have specific designees regarding what type of question you have. So it would be myself, Kelly Harvard, or Ming Zhao, who would answer questions depending on what type you have.
Okay, here's another one. This is interesting. Can stakeholders representing the CBOs be actual patients or clients of the organization?
I'm looking at Mike and Tim.
I don't, on paper see a problem with a client of a community-based organization playing a role in this, for sure. And sort of as a related comment, I saw that there was a question about could COVID survivors, contribute as a member of a CBO. And absolutely, we're keen to bring in the voices of those with lived experience of COVID, particularly from those communities most impacted. So for sure, that would be the case. Hope that answers.
Just to add to what Mike said, I think that, obviously we want this to be something you guys own and help design. So if the voices that you think are important to contribute to what a cultural humility training should look like for the constituents you serve are absolutely reasonable, and encourage voices to include how you see fit.
Thank you. Can we specify the service we would like to provide by language? So I guess the CBO with a particular expertise with a particular community.
Yeah, I mean, go for it, Kelly.
I was just going to say, in the sense that we're not necessarily providing a service, but a training, absolutely, we want it to be linguistically appropriate. So if you want to develop your materials in a language that benefits your clients and it's most closely aligns with your population, I would say absolutely. Mike?
I would agree. I think I have to add that most of the learners that have gone through the Virtual Training Academy speak English, and the training that we provide is all in English. But we certainly would like to have CBOs that, that represent communities that, for whom another language is their preferred language.
We do have some case investigators and contact tracers who are Spanish speaking, which is a huge need. And we actually do some of the practice with the script in Spanish. We've just started due to high demand. So if we had the subset of learners, it might be great to be able to provide this training in a different language for them.
Yeah. Maybe I'll pop in with this one question for you all. It's related to the actual work. Will the CBO stakeholders work together to develop the one-day cultural humility training and conduct the trainings together? So I thought that might be good for any of you to pitch in. I know this has been a community effort for the VTA, so whoever would like to take that.
I'll take a first stab. I think we really want you all to play a role in the creation of the content. And I think we're all really excited to do that as equal partners in the project. And our vision is that, you know, we could sit down, albeit remotely, and think through what the content would look like, and then, you know, divide up the responsibilities to generate that content. That's the second phase of the effort. And so, yes, we think that we would do that together. In the third phase, actually delivering the training, I think our expectation is that it may be a mix, you know, to start with. UCSF, UCLA, and you as our partners may do the trainings together. But our hope is that this could provide a growth opportunity for your CBO to lead in doing the trainings, and we would relinquish you to do that. Kelly, again, if there's anything there you want to add, please jump in.
I think you captured it well, Mike. Thanks.
Okay. Tim, did you want to add to? Oh, sorry.
I just want to say yes to that. Yes to what Mike said. I think that it'd be great. I think the more collaboration that happens in this project, the better. I think that we're also just wanting, I think he said this, but I just want to say this again. We're wanting you all to lead it, you know, to figure out what it is that you all believe would be the best way to reach people, you know, in this virtual way in contact tracing and case investigation. So we're looking for innovation and collaboration and representation. So yes.
I think.
Okay.
Go for it.
Go ahead. Okay, one more. In terms of training experience, is experience training advocates what you're looking for, or experience training the communities themselves? And a related question, are you considering offering subsequent training that would enable CBOs to conduct contact tracing within their own staff and volunteers?
I'd like to take a stab at that question. I don't know whether I'm best placed to. You know, I think the vision is that we would create content for our existing contact tracers. And so I think we're looking for folks that have expertise working with advocates in that sense, if an advocate could be sort of thought of as similar to a contact tracer. But I think in order to do that well, any experience reaching you know, your communities effectively from a training point of view will be regarded with, you know, will be esteemed in terms of the evaluation process. To your second question, look, I think we would absolutely love to train community health workers from CBOs to do contact tracing. There's no doubt that feels like the next phase of the COVID response. That's not what this project is about. We have this workforce that have been trained, and we want them to do as good a job as they can. But we would love to kind of think through, how can we partner with you to sort of motivate for CBOs to do the work of contact tracing, and see this as an opportunity to kind of shift the paradigm in how public health is delivered across California. That's beyond the scope of this project, but something I think we're all invested in trying to figure out.
I'll ask a few nuts and bolts questions maybe. One is, and this may have been mentioned, the first one is, what is the timeline of this grant? How long do we have to move through the steps? And as a placeholder, the second question is, any ineligible expenses to note for this FOA?
Kelly, do you want to do the timeline?
So the total timeline, as I'd mentioned in the terms of the phases, which is a little bit flexible, but we've allocated 6 months to the project. Phases 1 and 2 being 1 month each, and phase 3 being 4 months.
And then in terms of ineligible expenses, I may turn that to Ming. I think most of what we're anticipating in terms of expenses is personnel. Obviously, we're not traveling, we're not hosting meetings except on Zoom. So personnel, some reasonable administrative costs. And then if there's any procurement of hardware or software that's going to be required to actually do that work, we'll consider that as well. I mean, is there anything specifically that's ineligible?
That's pretty much about it for the current situation, right? The conduct training, you know, yeah. If they have a question when they develop the budget, they can ask us, you know, whether they want to budget this thing, and then we'll review case by case basis.
Okay, thanks.
I'll ask one more and then maybe I'll switch it back over to Stephanie, but this question is, does phase 3 have additional funding attached to it in terms of the future and subsequent trainings, or should we factor that into the 75,000?
So phase 3 does not have additional funding at this time. The cap is for this particular project is $75K, including your 15%, up to 15% indirects for your project. So for a total cap of the award or a ceiling of 75,000.
Okay, these are also related. California is huge. By funding 6 agencies, how will you ensure equitable distribution and representation across California? And for an organization that is statewide, how do you recommend that they partner with local public health authorities in their service area?
Karen, do you want to take a stab, or would you like me?
Why don't you go ahead.
Yeah, you know, I think in terms of representation across California, you know, and choosing only 6 awardees, we acknowledge that we're not going to be representative of all groups, and this is just a start. You know, our hope is that this is emblematic of a different way of engaging around public health, but sure, there's a limitation there. In terms of the question about if the CBO is statewide rather than geographically specific, again, I sort of return to the question before about, or the answer before, that if that CBO represents a group that is disproportionately impacted, then that will be regarded favorably in our review of the application. If the question is about how will any CBO engage learners from a particular jurisdiction, those details will become clear down the line, but essentially we anticipate that California Department of Public Health will generate demand for the training, the cultural humility training amongst contact tracers, and then there'll be a way to assign any given trainers from a specific location to work with one of the awardees. But that'll be figured out as we move forward.
Maybe I'll take one. Can you clarify how much time would be required for each individual, I think, agency that's participating? And I know that may be a little bit difficult to answer, but just in terms of the expected scope of work.
So Kelly, maybe we can answer this together. I'm just going to think through. So phase 1, if you're sending approximately 3 individuals through the Virtual Training Academy, it's about it's about 20 hours. If that's not all online, it's over the course of a week. So, you know, I guess that's 20 times 3. And then we'll ask for some of those individuals to also facilitate. So usually you know, maybe that's 8 hours once a week for 2 of those people or 3 of those people for a couple weeks. Kelly, I'm just thinking through this in a very specific way to help people. And then when we're actually spending that month, we're calling it a sprint to build the curriculum. My guess is that, you know, you'd spend, you know, maybe those 3 people would spend 2 to 3 full days a week for a month on that. Does that make sense? You know, maybe 50% time for a couple of them. The guidance, I think, is also in the FOA around this. And hopefully I'm speaking to the same thing. I'm just trying to think through it in my head. And then as we ask people to actually deliver the training materials, we anticipate it's a one-day training. So, maybe that's 8 hours once a week. I don't know. We've got to talk to CDPH how we want to get the people through, if we want to do it once a week. Once a week for 4 months, that'd be 1 day a week. I don't think there'll be that much work in between, assuming that the materials have already been developed. It would just be sending people to deliver the training materials during those 4 months. So, Kelly?
I think that's a good rough estimate of the time and the commitment from the agencies.
Thank you. Early on, there was a question that asked if the cultural humility module and curricula could be made available to interested agencies.
I'm not sure who gets to make that decision. I would say that would be fine, but I don't know.
I think we can do that. Tim, we can probably share the PDF of the slides,
Sure.
on the website, and Karen and I can figure out the logistics for that. That seems very
Great.
simple.
No, I think it would be nice for them to see it.
That's great. I saw some other questions about sharing, and I think that Kelly Harvard put a link back to the website where we're hosting the FOA. We're going to put we're recording the session. We'll put a link to the recording up there, a link to the slides, and we'll add the cultural humility training module as well.
I'll ask one more, then I'll hand it back over to Stephanie. And this is after the handoff. I think the question is, will the CBO be on their own financially to support training and finding sustainable or continued funding? So after this initial project period.
You mean after the 6 months, is there continued funding? You never know. I mean, maybe we could go after some more funding together. Maybe this will be so successful that we'll, want to go train some CBOs and we'll be able to, but right now there's nothing on the table and there's nothing guaranteed. But, there's a lot of opportunities right now for people who are doing good work with these communities. And I think, if we do it well, and we're working together well, that maybe there would be an opportunity to go after some additional funding, but there's nothing guaranteed right now on that front. Does anyone else have a thought about that?
No, I think I agree. I think, our optimistic vision is that this will be the start of a long-term partnership between us all, and we can do this work, this important work together, and model a different way to engage academic institutions, community-based organizations around the important public health work that we're all committed to. So fingers crossed that we're successful such that funders, want to fund us to do this. We'll have to wait and see.
Great. Yes, it is crucial work. Just a couple more questions. I think we're doing well, but if anyone has any more, please type them into the Q&A. Will the grant selection committee include a Latino or Latina?
In fact, the program manager that we're hopefully hiring is a Latina. So yes, she will be kind of leading and coordinating this effort. Fingers crossed that she'll say yes, but that's the intention.
Thank you. And have we considered reaching out to community health workers to be included as part of this process of training, development, and dissemination?
Yes, I mean, I think our hope is that some of the agencies that you represent will include among your staff community health workers who could do this work, and we would certainly be open to that for sure.
One additional question for participants that are attending the VTA training. If one staff person can't attend all of the 20 hours, would another person be able to attend and fill them in on what they missed?
Yes, and it's also much of it's videoed. I think the skills labs are probably sort of the most interesting or helpful if you're actually doing the work, and those are not videotaped, but all of the content is videotaped and accessible if you're not there live. The part you'd miss out on is actually practicing scripts and building those skills, interviewing skills.
Right, and I also would just say that, you know, they're running every week. So, you know, there are many chances to come on board and find it. So it's not like it's just happening once a month or every, you know, it's very accessible. We're running this every week.
And Tim, as far as I know, there are also additional skills labs that are open sessions. So if you are able to attend the training, but perhaps not that particular skills lab for your that training that day, then you can go on a subsequent day and participate in an open training.
Right, we have optional skills labs the last day of the Virtual Training Academy that is also open for people. So hopefully you can.
Great, this is related. How should CBOs go about choosing which individuals to send to the VTA? What qualifications would be appropriate?
Everybody's waiting for somebody else to answer.
No, I don't know. I would say it's a hard one because I think that there's so many different things that we're wanting out of this particular effort. And so part of it is you want people who could actually do that work. And I think a lot of it has to do with people who are comfortable, who are engaging, who are not afraid to ask the questions that need to be asked, who can build rapport, who have some information, who can learn that information that we need to give. And then, you know, who would also have ideas about how to do things differently. We want creativity too. So I think that whoever is, you know, making those decisions from the CBOs would probably have a good idea. And especially if you witness one of them, or if you come to see one of them or see what we're doing in some of the modules, I think it would help you to make that decision. But yeah, there's a lot of different criteria I think that would be important to consider.
And in the spirit of like continually improving the work that we're doing, you know, we're excited for you to participate in the VTA and then, you know, learn the role of facilitation or do the work of facilitation so that we can improve the training that we're providing. And I think your insights could be invaluable to that end.
Great. I see that we're about 2 minutes off from the top of the hour. So is there one or more burning question or something, or should we just trying to keep track of time?
I think that actually the time has matched the questions well, so I think we can probably wrap up.
Excellent. So we will get back with an FAQ document that hopefully summarizes some of these questions as well, and then get back to, I know there was that question around eligibility that we owe as well. Do you want to wrap it up, Mike? Or?
I'm happy to say something, which is just, again, thank you for even, you know, getting on the call with us today. We're hugely excited by the opportunity and the privilege of being able to work with some of you. We think that this is incredibly important work, not only in, you know, preventing the spread of COVID within our state, but also reframing how we do public health so that we can do it in a culturally responsive, humble way, reaching those communities that historically have been disproportionately impacted by many health inequities, not just COVID. And so working with you to redress those inequities feels like a really important work. So thank you all for partnering with us, and we look forward to hearing from you all soon.
Thank you.
Thank you.